was when she graduated with 700 other students.
In spite of what appeared to be increasing enlightenment, 75% of institutions in the United States were built after 1950. Institutions continued to be the predominant mode of care. Roland Johnson, who in later years became a leader among self-advocates, spent 10 years as a child at Pennhurst. His following comments were excerpted from a radio interview that took place at the time Pennhurst was being closed.
I think I went to Pennhurst when I was under the age, I think, 8 years old, because at that time there was no human services workers at that time to deal with the family. Or at the time I was sexual abuse and nowhere to break away from them and tell them that, no, you can't do this, no, you can't do that. It wasn't staff, it was patients, like grown patients, patients that higher function patients. They would have sexual with the client, with little kids. And I was very hateful to just to holler out and scream and say, help, because no one will help. There was clients, other clients, being abused, getting hit over with the mop. And this is not patients doing this, this is staff. They would had to lie about it, that when the parents would come to see them, they would say, well, we didn't do that. And if you go and tell your parents that we did it, we'd find out. We would write a little note and put you on another ward. They put you like in a hole, a sweat box. And they would beat you up there if you told your parents that this was happening.
Evidence indicates that many children and adolescents were institutionalized due to a lack of community services and supports to families.
A lot of people who were up here never belonged up here. They put them up here because the parents was unable to take care of them, or they didn't want the children.
My mother was unable to take care of me because I had no care when I was living with her. I was left alone sick at the house.
I came to Pennhurst because my parents had marital problems, and my father accidentally suffocated me with a pillow at 4 months, and the home broke up, and they were unable to take care of me because of the expensive. And my mother put me up here to keep me away from my father.
My grandmother and my Uncle Idris put me away. All my sisters put away.
They've gone through things that most of us couldn't even imagine. Just how they got here. Families disintegrating, being picked up by the authorities and shipped off. In many cases, 5 and 6 siblings being shipped in 5 and 6 different directions, never to hear from one another again.
I think one of the reasons why we have had places like Pennhurst and why so many people were sent here were because of a lot of different inabilities of families to handle children. Sometimes children who were just bad children, quotes, bad children, were threatened that they would go to Pennhurst if they didn't shape up, they didn't behave. And sure enough, a lot of people were sent here for that reason. So in a way, that was one of the reasons why people were sent here who shouldn't have been here.
Through medical advancements, more and more children with severe disabilities overcame life-threatening conditions, but they needed ongoing extensive care. These institutions, which were originally designed for people with mild disabilities, were now admitting people with exceptional needs. Without adequate staff resources, the more capable residents were assigned direct care responsibilities.
The people who were known as the working patients, the work boys, the work girls, it was obvious to me that there was no reason for them to be here other than to take care of the people who were less capable.
Now, one of the problems that we had when we first started taking people out of Pennhurst and putting them to work in the community was But the people who worked here got very, very upset because we were taking away their working boys and their working girls, and that left them short of staff. And those were the people who were doing all of the work.
When I was in Pennhurst, I used to go down over the hill here, and I used to feed them and clean them up and change their beds. And I used to put jackets and diapers on them, I did, and rompers, I did. I got that. And when it was time for them to get changed, I cleaned them up and all I did.
Well, I used to help them bathe, get dressed.
When I was done in the day room, I took care of my room, and the ones that is not capable take care of their room. Why, we try to take turns about try to straighten their room up.
Institutions continued to be troubled by insufficient staff with little or no training. Dehumanization was inevitable under such conditions.
And the thing that was so devastating to me was not just the cages that they had at the time, but when we walked into the back and saw the cemetery, and there were over 1,000 stones, and there were no names, just a number.
I cannot get a legislature, as hard as I tried, to come in and look at the inhumane conditions we had patients under. That was not a high priority item. That was not a highly valued type of behavior on the part of a member of the legislature. I became commissioner of mental health, and I well recall the struggles I had with buildings, patient buildings where the roofs leaked, and I could not get the funds to fix the roof. The barn leaked, we got a new barn for the cows. Our staff who took care of the cows, our swine herdsmen, took care of the cows and the pigs, were paid a higher salary than our aides and attendants who took care of the people.
At this juncture, residents began reacting to this environment with outbursts of frustration.
Back then, they used to eat the patients.
I was punished for it. Oh boy, they beat the patients like that's why many people died up here, because they got beat to death.
I don't want them young kids, the young kids go at the state hospital like I did, because it's bad up there. Because they beat you up, they dope you up, they lock you up in a cruising. I don't want that.
I think the one lesson that we can learn from the lives of people who lived through the Pennhurst of the world, and we shouldn't just focus on Pennhurst, because I think Pennhurst has become a symbol of what we as a society did to those people that we dehumanized and pushed off in a corner. Those folks have an enormous capacity to live through the pain and the resilience of the human spirit that they've demonstrated by moving through it and going on with lives is just incredible.
Even while institutions were increasing in numbers, many in the professional community were embracing the merits of community placement. As early as 1950, Hilda Bangs, then Mental Health Commissioner of Pennsylvania, was among the first to view institutions as only one episode in the total design of living. As one of the first voices to support community programming, she stated,
"The institution at its best is a poor substitute for the private home and its free community."
Another important voice from Pennsylvania was an ardent advocate named F. Hackbush. He was instrumental in calling for due process of the law as it applied to admissions practices to institutions.
Placement in an institution for mental defectives is a serious matter and should be made only after measures have been taken to prevent unnecessary and unjust institutionalization. Legal commitment procedures should be designed to protect the civil rights of the individual.
when I was a child. I think the doctor said that, well, he's just a little retarded person, that he just can't keep up with nothing. You can't just control him. But at the time, I guess at that time, they didn't do no psychological testing. They didn't really know what was going on. And then I had like cry with tears. Why did my mother put me here in the first? Well, why did the court judge put me here or send me here instead of trying to work out some kind of way with my parents?
On January 20th, 1961, John F. Kennedy was inaugurated 35th President of the United States. Having had personal experience with a sister with mental retardation, Kennedy was determined to improve the quality of life for all people with disabilities. Many perceived the disability rights movement as an extension of the civil rights movement, with civil rights activism creating perhaps the most sympathetic environment of the 20th century. Kennedy's historic panel on mental retardation presented 112 sweeping recommendations. These guidelines literally redefined the mission and methods necessary to enhance quality of life for all persons with mental retardation.
Through legislation driven by the Kennedy administration, laws were passed, and society began to, again, think differently about people with disabilities. They began to realize they needed the same educational options, educational choices, educational opportunities as a typical child did. They began to realize that people with developmental disabilities wanted to have a family. They wanted to live in a home in a typical neighborhood. And in 1966, the MHMR legislation was passed, and our system began to change. Society, again, began to think differently about people with disabilities.
What was needed was not so much treatment for many of these patients as looking at them as people. People who had, for one reason or another, either been deprived of or lost their skills in living in the type of competitive society, social structure that we have, and needed actually both a combination of retraining in social skills, but also an opportunity to live in environments that were supportive, understanding, and appreciative of the kinds of difficulties they were struggling with, and provided opportunities for them to live and grow and develop and live up to their maximum potentials in spite of their disabilities.
In 1966, the Mental Retardation Act in Pennsylvania officially sanctioned a community-based system for supporting persons with mental retardation. Then, in 1972, the Right to Education Consent Decree in Pennsylvania guaranteed that all residents of the Commonwealth had the right to attend school. That same year, the first community-based housing was established outside an institutional setting, and the way was paved for what has become, since, a comprehensive system that allows for placement of individuals at various levels depending on their physical and professional needs.
Leonard and I were married August 3rd, 1971.
Violet and I lived at our apartment since 1986.
We take walks, and I cut coupons and sort them with a magnifier, and I do spool knitting and make coasters out of them. We do it, and we go to church on Sunday.
Our life is very good.
I got out of the state hospital. I live in this family, and I like this place.
I'm enjoying my life very much. I go to church every single Sunday, and I sing in the church choir, and I like it very much, and they're very well pleased about me. They are.
I'm getting married.
Today, over 70,000 people are receiving supports and services from Pennsylvania's mental retardation system. Of that number, 2,700 live in public institutions and 68,000 live with supports in their communities. Objectively, the journey of persons with mental retardation in Pennsylvania, as well as the rest of our country, has been more of a roller coaster than a smooth ascending ride. Over the last century, care for people with disabilities has been handed off time and again like a baton in a relay, switching hands from the church to politicians to the medical establishment to professionals. Now, voices are starting to emerge that are strong and steady. Today, an entire movement is voicing its expectations as well as aspirations with greater impact each passing day.
I want to be in charge. Can you say that with me? I want to be in charge over my own life.
There's nothing too hard to do if you put your mind to it.
We can make people really proud who didn't think that they could have a voice and stand up for their rights.
Believe in yourself, know your rights, and stick up for what you believe in.
I mean, this is kids, people we're talking about. It's not like a number or a thing or an issue. It's a life. It's a child. It's my child's life.
What we've done in our community is actually not given them the choice of whether to include Adam or not. We've just signed him up for whatever, soccer or baseball, and said, this is Adam. He's 8. He's eligible for baseball, and we want him to play on your team.
2 school buses pulled up in our development to pick up Alexa, was to go on the one school bus, and her sister, who's only 2 years older, was going to go on the other bus, and yet they were going to the exact same school. And so for a year, we worked with the school district as to how we might get this in place so that they could both go on the same bus. Our school district retrofitted a bus, and now she goes on the bus with all the other kids in the development.
What's important is to look at the individual, what their strengths are, and help them reach their potential and do their thing in life that was their gift from God, to allow them to be a part of the community like everybody else.
His opportunities are limitless. He can do what his sisters will do within the community. He can play what his sisters play in the community. He'll have friends, he'll have lovers, he'll have whatever he needs to have to make his life special to him.
We are speaking for ourselves, speaking for ourselves. No one else can do as well, speaking for ourselves. Once I
think it's really neat that we showed them that we could do it for ourselves.
Someday I'd like to get married and have a family.
I want to get an apartment or home or trailer or take care of my own. Really like to get into saving lives.
I go to the mall by myself, and I go to work by myself.
I live on my own. I'm well independent, I am.
I like to have a job to take care of kids and babysit.
I'm going to plan getting married and stuff like that. And I'm engaged and stuff.
They try to do their very, very best to help me to go out to be a strong black man.
USA, of the people, by the people, for the people, all the people.
We are speaking for ourselves. We're speaking for ourselves. No one else.
It is wonderful to have a voice and be heard.
One thing is for certain. If we as a people will it, all people living on this miracle we call Earth can and will have a voice.
We've been made to feel ashamed. We've been locked behind the door, but we'll come outside once more. We are speaking for ourselves. We're speaking for ourselves. myself.